So let's talk about the different treatment approaches when it comes to the management of IBD or irritable bowel disease. So irritable bowel disease can be, it can be pancolitis, it can be ulcerative colitis, it can be Crohn's disease. And so with our traditional approach, with the traditional medical model versus our functional medicine approach, these two approaches are very different. So with traditional medicine, typically what will happen is once you're diagnosed with this condition, the doctors will then put you on a round of steroids, a round of prednisone, or some type of anti-inflammatory to calm the inflammation down, so that way it hopefully stops the attack from the immune system. And so maybe that helps a little, or maybe it doesn't. Then they're going to take that approach on to some stronger medications such as immunosuppressants and maybe Humira. That might be an option that you've been told. Whereas with functional medicine, instead of just turning off the immune system, what we're going to do is we're going to come upstream to that diagnosis and find out really what it is that's fueling and driving this process, okay? So from a genetic standpoint, what are your genetics? What are your inflammatory cascade genetics? What are your oxidative stress genetics, your methylation, your detoxification? Because with that, we can then start to see where the faulty switches are with your autoimmune condition. Also, by looking at the gut health and really seeing what is making up that microbiome. So we have billions of bacteria and yeast within the gut. Those are good bacteria and bad bacteria, but it's when they're no longer keeping everybody in check that we will actually develop what's called a dysbiosis. And once that happens, once you have maybe a resistant bacteria that is now taking over and colonizing, that can then be triggering that immune system to come in and start to attack the intestines. So instead of just shutting the immune system off, because we need our immune system is actually what helps us to stay healthy. We want to support the immune system. We want to reduce inflammation. We want to restore that gut microbiome so that the balance of good bacteria and bad bacteria and yeast are all keeping one another in check. And that is how you can reduce symptoms without taking on the risk of some of these larger side effects that can come from the immunosuppressants. So if you're interested in learning more about how the Center for Holistic Healing, our functional medicine program, goes about helping clients with IBD overcome these symptoms that they're experiencing, then I'm more than happy to jump on a call and kind of go over some of the different ways that we've helped other clients with these similar issues. All right, thanks. Have a great day.